Bismillahirrahmanirrahim. Hadith of the day. Prophet, peace be upon him, said, right, righteousness is good character, and sin is whatever bothers you and you don't want people to know about. Assalamu alaikum, everyone. My name is Dr. Marina Akhtar. Today, my topic of presentation is food safety and hazard analysis and critical control pathway. I am presenting this topic under the kind supervision of my professor, Dr. Saira Afzal. Learning outlines. Introduction to food safety, its importance. Introduction to HACCP, Hazard Analysis Critical Control Point System, and its importance, its 7 principles, and situation of Pakistan in food safety. Learning outcomes. At the end of this presentation, the participants will be able to describe the various aspects of food safety, 7 principles of hazard analysis, critical control point system. Food safety. Food is a potential source of infection and liable to contamination by microorganisms at any point during its journey from producer to consumer. And food hygiene. Food hygiene can be grouped under the following headings. Number 1, milk hygiene. Number 2, meat hygiene. And number 3, fruit and vegetable hygiene. And under the milk hygiene, the processes, methods of pasteurization. Milk pasteurization, there are 4 common types of milk pasteurization that vary with temperature and time the milk is held at that temperature. Number 1, wet pasteurization. Number 2, high temperature or short temperature process. Number 3, ultra pasteurization. Number 4, ultra high temperature pasteurization. Other methods used for other foods are flash pasteurization, steam pasteurization, irradiation pasteurization. Principle of food preservation. Prevention. First is prevention or delay of microbial decomposition. Second is prevention or delay the self-decomposition of the food. Third is prevent the damage caused of insect, animals, and mechanical. Method of food preservation. It includes removal of microorganisms, that includes avoidance of microbial contamination, physical filtration or centrifugation, and low temperature refrigeration or freezing, and high temperature partial or the complete heat inactivation of microorganisms, reduce water availability or dehydration, that include water removal, and then chemical based preservation, that includes addition of specific inhibitory compounds, for example organic acids, nitrates, sulfur dioxide. And 6 is radiation, use of ionizing gamma rays or non-ionizing ultraviolet radiation. And 7th is microbial product-based inhibition. That includes the addition of substances such as bacteriocins to food that control food and foodborne pathogens. Need for an effective food safety assurance method. Its need is by foodborne disease are widespread public health problem and emergence for food disease, and increased knowledge and awareness of the serious and chronic health effects. New food technologies and processing methods are needed, and increased awareness of economic consequences of foodborne diseases. Hazard analysis and critical control point system for food sanitation. H for hazard, A for analysis, C for critical control, and P for point. History of HACCP. Hazard analysis and critical control point, HACCP, was developed in 1960s in the United States. United States to ensure the food safety for the first manned national astronauts and space administration space mission NASA. NASA required a zero defect program to guarantee safety in the food astronauts consumed in the space, as this is the only source of food for them. And this is a timeline for the introduction of the food safety management system. In 1990, international HACCP alliance formed in 1994. Safe and quality food formed, and in 1998 British Retail Consortium is formed, and in 2000 Global Food Safety Initiative formed, and in 2003 International Standard formed, and 2004 Foundation of the Food Safety Certification formed. In 2005 ISO 22000 Food Safety Management System is formed, and 2009 Global Red Meat Standard formed. Hazard Analysis Critical Control Point System for Food Sanitation. Its introduction is HACCP is a management system in which food safety is addressed through analysis and control of biological, chemical, physical hazards from raw material production, procurement and handling to the manufacturing, distribution, and consumption of the finished products. The 7 principles of HACCP or Hazard Analysis Critical Control Point System have been universally accepted by the government agencies, trade association, and the food industry. These 7 principles include: Principle 1 is conduct a hazard analysis. Principle 2 is determine the critical control points. Principle 3 is establish critical limits. Principle 4 is establish monitoring procedure. Principle 5 is establish corrective action. Principle 6 is establish verification procedure. And Principle 7 is establish record keeping and documentation. We will read their details further. In principle number 1, conduct a hazard analysis. Firstly, identify and do risk analysis. You or your HACCP team must recognize where there is the chance of hazard and list them out. And second principle is identify the critical control points. A critical control point is the process to find and take necessary preventive measures. A critical control point may manage more than one food safety hazard. Principle number 3 is establish critical limits. After identifying the critical control points, we need to establish the critical limits for it. Critical limits are the range of maximum and minimum biological, chemical, or physical factors at a critical control point that must be controlled. Monitor critical control point. Monitoring requires planning and sequential observation done to see all the critical control point is under control. It checks the established critical limits for each critical control point and measures if it is working correctly. Establish corrective actions. Even with the critical limits and food safety management in process, the problems can be occur at any time, which can cause a health hazard. When any kind of problem occurs or there is the deviation in the critical limits, you have to take corrective action for it. And principle number 6 is verification. Verify all the activities that are in place to prevent hazards are working properly and doing their work. You have to determine if your HACCP system is working according to plan. And documentation. The final principle is to record the everything of HACCP food safety management system and to keep records of all procedures. And application of HACCP. Assemble the HACCP team and describe the product, physical and chemical characteristic, identifying the intended use and constructing the process flow diagram and logic sequence of HACCP in process flow diagram, and to identify all the hazard at each step and to identify the critical points and limit it with appropriate corrective actions and its verification and documentation. WHO 5 keys to safer food. 1 is keep hands clean. 2nd is separate raw and cooked food. Number 3 is cook food thoroughly. 4 is store food at the safe temperature. And 5th is use clean water and raw material. And WHO 5 keys to a healthy diet. Number 1 is breastfeed babies and the young children. Number 2 is eat a variety of foods. Number 3 is eat plenty of vegetables and fruit. Number 4 is eat moderate amount of fats and oils. And number 5 is eat less salts and sugars. Food surveillance. Food surveillance is an essential for the protection and maintenance of community health. Broadly, it implies the monitoring of food safety or food hygiene. The WHO has defined safety or food hygiene as all conditions and measures that are necessary during the production, processing, storage, distribution, and preparation of the food to ensure that it is safe, sound, and wholesome and fit for human consumption. The Declaration of Alma Ata considered food safety as essential component of primary health care. In Pakistan, food safety standards are checked by provincial government. Imported food is regulated by the federal government, and food standards cover agriculture and foodstuff. However, implementation is poor. Punjab Food Authority. What is Punjab Food Authority? Punjab Food Authority is an agency of provincial government of Punjab in Pakistan. It regulates the food safety and hygiene in the province. It was formed under the Punjab Food Authority Act 2011. Enforcement of the food hygiene and quality standards are described in the Punjab Food Authority Act 2011 and the Pure Food Rule 2011. Functions of Punjab Food Authority. The Punjab Food Authority Act 2011 entrusts the Punjab Food Authority with following functions and responsibilities. First is the Punjab Food Authority regulates and monitors the food business in order to ensure the compliance by farmer, manufacturer, distributor, importers, and other stakeholder groups in order to provide safe food. And second is formulate standard procedure, processes, guidelines in relation to any aspect of the food, including food business, food labeling, food additives, and specify appropriate enforcement system. And other is enforce food safety and quality standards. And also Punjab Food Authority specify procedure and guidelines for setting up and upgrading food laboratories, and it specify licensing, prohibition orders, recall procedure, improvement notices, and prosecution in the court of law. It provides scientific advice and technical support to the government in matters related to food safety. It has role in establishment of food laboratories. And it organizes the training programs in the food safety and standards. It promotes general awareness regarding the food safety and standards. It certifies food products or items for export. It forward and backward traceability of the food items. And it has role in surveillance, including the collection, integration, analysis, interpretation, and dissemination of the data related to food and nutrient intake. Regulation of the imported food products. The federal government applies codex standards and guidelines in its regulation of imported food products. US Food and Drug Administration standards also are used for certain products. A list of permissible food colors is updated every year. For animal products, halal certification slaughtered in accordance with Islamic law is required. Pakistan, as a member of International Organization of Standardization ISO, continues to harmonize standards with international requirements. And again, Punjab Food Authority has been established under the Punjab Food Authority Act 2011 to ensure the availability of the safe and wholesome food for human consumption. And now the test for food safety. On-spot testing through the rapid testing kits. To check the quality of food items through on-spot kits, the kits are used to detect various adulterants in milk, spices, tomato ketchup, and also rancidity in cooking oil and ghee. Instead of archaic practice of drawing samples across the board, the field teams draw samples of only those food products and send them to the laboratories which fail to pass the rapid testing test. Raids at the entry point of Lahore. During the milk raids, rapid tests are applied to check the possible adulteration of the milk with water, urea, formalin, and detergents and starch. Samples of only those vehicles that had been drawn and sent to the laboratory which had failed to pass rapid testing. Substandard oil and ghee. Sample collected from roadside vendors out. Prosecutions were launched in the Court of Special Judicial Magistrate concerned in respect of the all substandard samples through the instrument testometer. Rancidity cast in oil due to repeated frying is checked by the field team on the spot. Enforcing ban on the sale and or purchase of the open oil or ghee. Tomato ketchup, spices, and rotten eggs. Detect adulteration of the starch in tomato ketchup. They have been equipped in the rapid testing kits. Total number of premises checked on account of tomato ketchup counted at 1,032, out of which 140 samples were found adulterated with starch. And continue. In addition to the launch of prosecutions in the court of law, notices under the section of 20 of the Punjab Food Authority Act 2011 to rectify their respective products. The manufacturers were, for the time being, directed to stop manufacturing the products till the time proper rectification with regard to ingredients, labeling, and the premises related shortfalls are fixed. Enforcement mechanism of the Punjab Food Authority. Different types of methods are used by Punjab Food Authority to enforce these standards. Number one, sending notice to the stakeholder. Number two is the by finding the industry. Number three is seize the specific products or whole industry. And this is the खुराक का आलमी दिन 16 अक्टूबर. सेहतमंद खुराक सेहतमंद माशरा. ISO 22,000. The ISO 22,000 standard is the first international standard for implementation of the certified food safety management system. It covered interactive communication, system management, and hazard control. Now coming to the recent updates. Our first article is food safety during and after the era of COVID-19. In this article, it is recently data on the survival of SARS-CoV-2 contact service has been reported, but there is none on the survival of COVID-19 on food services and packages. The potential survival and transmission of SARS-CoV-2 on or via food and packages are discussed based on data available for other respiratory viruses such as SARS-CoV and MERS-CoV. And however, studies are needed to explore its transmission via food survival on the food packaging. The implementation of the food safety management system such as hazard analysis and critical control point HACCP and good manufacturing practices are important to reduce the risk of COVID-19 infection. Cleaning, sanitation, good hygienic practices, and active packaging are also needed from farm to fork. And second article is safety assessment of foods at the Capital Hospital of Pakistan through the hazard analysis and critical control point system. Food safety is the current challenge that needs to be addressed globally to overcome the burden of foodborne disease. In this study, food samples collected from the Pakistan Institute of Medical Sciences, Islamabad, were analyzed for microbial quality. The results showed that there was microbial contamination in the food served at hospital under investigation for this study. Most of contamination existed because of non-hygienic practices by the individuals and the serving places. Salmonella, fecal coliform, fungal cross-contamination was reported. A hazard analysis and critical control point system was implemented to study what area are at great risk and are the reason of contamination in the hospital. The study concluded that high prevalence of the microbial contamination was observed in the facilities of Pakistan Institute of Punjab Sciences Hospital, requiring strict preventive and precautionary measures to be taken to ensure the safety and the health of the patient and attendants in the hospital. And third article is hazard analysis and critical control point of the weaning food. Hazard and critical control points were identified during the preparation and the feeding storage of the weaning foods fed to the children 6 to 24 months belonging to the low income group. LIG, families using survey methods, spots, in-depth observation, and microbial analysis. High microbial counts were obtained for the weaning food samples procured from the families that are rated as a poor for both personal hygiene and environmental sanitation. Food samples that were held in ambient temperature 25 to 35 showed high count of the coliform AMCC yeast, molds, Staphylococcus aureus, and Bacillus cereus. And and MOP sample was revealed high count for all these organisms. Coliform were not isolated from the water samples of all 10 households. However, a high count of Bacillus cereus was observed in the water sample of 2 selected households. The hazard and critical control points identified were high initial contamination of the raw foods and poor environmental sanitation and personal hygiene and feeding up overnight moist foods. And now coming to our MCQ session. MCQ number 1 is, in a dairy processing facility, you identify a potential hazard related to allergen cross-contamination. What should be an appropriate corrective action according to HACCP principle? Option A is increase the production speed. Option B is implement a clean and sanitation procedure. Option C is change the packaging design. Option D is hire additional staff. Option E is ignore the identified hazard.
B.
Yes, B is the right answer. Implement a clean and sanitation procedure. MCQ number 2 is, you have a leftover from dinner and want to store them safely. What is the ideal temperature for a refrigerator to ensure food safety? Option A is 32 degree Fahrenheit or 0 Celsius. Option B is 40 degree Fahrenheit or 4 Celsius. Option C is 50 degree Fahrenheit and 10 Celsius. And option D is 60 degree Fahrenheit and option E is 70 degree Fahrenheit.
B.
Yes, B is the right answer. MCQ number 3 is, Mr. Ali is conducting a hazard analysis for a new food product. What is the example of a chemical hazard that should be considered? Chemical hazard. Option A is cross-contamination. Option B is salmonella contamination. Option C is allergen in the ingredients. Option D is presence of foreign object. Option E is pesticide residue.
E.
Yes, E is the right option. MCQ number 4 is, Mr. M is in charge of the food processing facility. During the hazard analysis, he identified a potential biological hazard in a raw ingredient. What is the next step in a HACCP process? Option A, establish critical limits. Option B is conduct a risk assessment. Option C is implementing corrective action. Option D is identifying critical control points. And option E is verifying the HACCP plan.
B.
It's D, identifying the critical control points, which is the second law. MCQ number 5, Mr. Salim is managing a restaurant kitchen and implementing HACCP principle. What is the primary goal of hazard analysis and critical control point? Option A is enhancing the taste of the dishes. Option B is identifying and controlling the potential food safety hazard. Option C is increasing the speed of food preparation. Option D is reducing the cost of ingredients. Option E is improving the visual presentation of the food.
B.
Yes, B is the right answer. MCQ number 6 is, Mr. X is a food business owner in the Punjab and the Punjab Food Authority has recently introduced a new regulation. What is the primary goal of the Punjab Food Authority? Option A is increasing the cost of the food products. Option B is simplifying food labeling requirement. Option C is promoting food tourism in the region. Option D is ensuring the safety and the quality of the food products. Option E is encouraging the use of traditional cooking methods.
D.
Yes, D is the right answer. MCQ number 7 is, Mr. Ali is a food importer in the Punjab. The Punjab Food Authority has strict regulation regarding imported food. What is the one key requirement for the imported food products? Option A, adherence to the international fashion trends. Option B is compliance with the local music preference. Option C is labeling in the local language. Option D is using traditional packaging method. Option E is Incorporating local spices in the product.
C.
Yes, C is the right answer. Labeling in the local language. MCQ number 8 is XYZ company is undergoing in ISO 22000 audit. The auditor is assessing the company's hazard analysis and critical control point plan. What does ISO 22000 emphasize regarding HACCP? A. HACCP is an optional in ISO 22000. Option B is HACCP is the sole focus of ISO 22000. Option C is ISO 22000 does not address HACCP. Option D is ISO 22000 integrates HACCP principles, and option E is HACCP is only relevant for small business.
D.
D
is
the right answer. ISO 22000 integrate HACCP principles. MCQ number 9. During on-spot testing in a food processing plant, a potential allergen contamination is discovered. What type of the rapid test method would be appropriate for confirming the presence of allergens? Option A, sensory evaluation. Option B, chemical testing. Option C, nutritional analysis. Option D, amino acid testing. Option E is microbiological testing.
B.
For the presence of allergen, it is D.
D.
Yes, D, amino acid. 10 is as a food vendor participating in a local market, a HACCP team member is interested in on-spot testing for freshness of his produce. What rapid test method could be employed to assess the quality of fruit and vegetable quickly? Option A, microbiological testing. Option B, sensory evaluation. Option C, chemical testing. Option D, amino acid testing. And option E, nutritional analysis.
B.
Yes, sensory evaluation for quick analysis. Key of my MCQs, and this is YouTube link of our channel. Kindly like and subscribe, and thank you.